Hello, I'm Dr. Dennis McKenna, joined again by Dr. Venditti, our hospital system general director, giving you the update on coronavirus from Albany Med. Today in Albany County, there are 176 confirmed cases of COVID-19. Here inside the medical center, so far, we've had 22 cases that have been admitted to the hospital. 12 of them have been discharged. We currently have 10 patients in-house. 4 of those patients are in our ICU. 6 of them are in the floor. A couple points. First of all, the children have both been discharged. This is great news. We talked about the 2 children the other day, so both of them have been discharged to home. I'd also like to call out the great work in our ICU, currently D3 North and the medical ICU. Incredible team of doctors and nurses and respiratory therapists really caring for that population in an incredible way. So congratulations to them for that great work. In the region, we want to focus on those numbers as well. There are currently 46 people who are admitted to all the area hospitals. That number is up from yesterday, which was 43. So we're keeping a close eye on that number as well. We currently have an adequate number of beds, ICU, and staff to care for all the patients here. Once again, we turn to Fred for an update on PPE.
So we continue to have adequate numbers of PPE. Again, PPE is personal protective equipment like masks, face guards, shields, I should say, and gowns. I would say that we have done a really good job getting those resources into the organization, but we're also using them at a much more rapid pace than we've used them in the past. We're currently keeping pace with the amount of use, replenishing the stock, but I do want to make that point. We are using them much more rapidly. I would like to point out today that we have some apparel on from our security folks. I think I've been promoted. I'm a security officer now. The security guards have really done a tremendous job. You see them when you come into work. They're at all the entrances. They really have stepped up in terms of what they're doing to protect the organization and to protect our supplies. They've done a tremendous job with that as well.
They're an incredible part of our team.
They really are a very important and very incredible part.
Speaking of the members of our team, I mentioned earlier in the week that we could report out a number by the end of the week that are working from home. That number right now is 933. So we started the week with about 100. We're now at 933. That's incredible. I'd like to thank the HR department and Darlene Souza, our IT department with George Hickman, and our Pillars 22 lead, Kim Williams, who made that happen, and everybody else. It's remarkable. And if you're watching from home, we thank you for the good work you're doing there as well. Speaking of good work, we've spoken a lot about the hospital inpatient. We've spoken a lot about the practice, but there's another element, which is outpatient services, which falls under you, Fred.
That's right.
And there's about 8 different areas that's covered by. I'll name them quickly, and I'm going to ask you to speak about a couple of them. So we've made changes in cardiorespiratory services, our neurophysiology lab, non-invasive cardiology, outpatient psychiatry, pathology and laboratory medicine, pharmacy, radiology, and rehab. They've all made changes in the current environment of COVID-19. Can you highlight a couple?
I can. So first of all, I would say all of them are adjusting to a change in our volume or their volume. So that's been very important. I would perhaps highlight the imaging group, radiology. They have been working very diligently to move the outpatients out of this building to South Clinical Campus, so our facility on Hackett. They're calling it South First, so when patients need an outpatient CAT scan or an MRI or some other kind of imaging, they're first offering them slots at that facility so they don't come to the main campus, but still get the care that they need. With the pharmacy group, they continue to provide both inpatient and outpatient services.
Right.
They've been sort of the point of the spear on working from home, and I'm happy to report that that's been working really, really well for them. They're very efficient from home, and we're going to continue that, I think, post-coronavirus.
Wonderful. So maybe we'll highlight some of the others as the weeks go by.
We certainly can.
Speaking of those areas, rehab in particular, the fitness center falls under rehab, and they have been gracious, and they've actually created some videos on yoga and meditation since our fitness center is closed. And they're going to make that available to our workforce, which we think is a great thing. They were enthusiastic to do that, so I think that'll be included in the messenger that goes out. So we look forward to that as well. Speaking of videos, we use these to educate you. I think that we are also seeing the videos and pictures that you've put out there, our workforce, whether it be in rainbow scrubs or other things. And so I'd say you inspire us. We educate you, but you inspire us. So we thank you for all of that as well. Finally, this is a serious topic. And we do take it very seriously, but we do have to keep our spirit about us. So Fred, a couple of people have reached out to me, and I have a question for you, which I don't think you're planned for, which is, do you ride a motorcycle? The viewers want to know.
So
The viewers want to know.
So it has been put out there that I ride a motorcycle. I think it has something to do with my mustache. My mustache, first of all, has been something on my person since 1974. I have to admit, though, Dennis, I've only ridden a motorcycle once in my life.
Yes.
It was not a Harley. It was a Honda, and it was quite an adventure.
Okay.
But no, on a regular basis, I do not ride a motocycle.
All right, well, the viewers wanted to know.
I know.
So there you go.
There you go.
All right, well, anyway, we'll be here this weekend working
will.
on this issue, and we will see you next Monday. In the meantime, we ask that you take care of yourself, take care of each other, and we'll see you Monday.